Welcome everybody. We'll just wait a few more seconds for people to join and then we'll make a start. Okay, we'll make a start now. Welcome everybody. This is a webinar for the NIHR Northeast and North Cumbria Health and Care Professionals Internship Programme. This webinar is targeted at our consortium members, so those are organisations that supported us with our application for this funding, and also for organisations in the Northeast and North Cumbria. I'm Simon Hackett, I'm the programme lead, and I'm going to talk you through the internship program for about 30 minutes, and then we have a guest speaker as well. So just in terms of a webinar housekeeping, if this is being recorded and it will be made available on our website, so do keep your microphones on mute during the presentations. If you don't wish to be seen, then you can turn your camera off as well. If you would like to put some questions in the chat, we will go to a Q&A session at the end and we'll get through as many questions as we can. If those questions are particularly relevant to you and they've been asked already, do put a thumbs up to let us know that that's an important question for more than one of you. And if there are any questions we can't get to or we can't answer immediately, we will be updating our FAQs document, which you'll also have access to as well. So we're here to talk about the Northeast and North Cumbria Health and Care Professionals Internship Programme. This is a programme funded by the NIHR and hosted at Cumbria, Northumberland, Tyne and Wear NHS Foundation Trust in partnership with Newcastle Health Research Partnership. And I'm going to talk through these sort of three things, which is why research is important to your organisation and how to support interns within your organisations. We'll go through the what, so the eligibility, the intern pathways, development and duration, and then how, so the timeline, the application support and submission, and then we'll welcome Professor Hamdi Nazar, who's going to talk from a mentor's perspective to give you some ideas about how that's worked in previous internship programs. So this program fits within the NIHR Academy's expanded portfolio of career support, which was published back in April 2023. It was a new initiative at the time to expand provision of training and career development opportunities for health and social care professionals, and you can look at the detail of that via the link on the website. So this sits then within the funded career development opportunities for the NIHR. So you can see that the internship program fits within the initial experience and introductory part of the program. And it works all the way across from pre-PhD to PhD right through to research professorship. So it's an extensive career development pathway, and this internship program is about health and care professionals and those in social care and public health having that introduction to research in their careers as well. So just to tell you a little bit about why engaging in research as an organisation is important, there is a link between organisations and staff engaging in research and improvements in service user outcomes. Now, a lot of the research around this has been done in healthcare settings rather than social care settings at the moment, but there is extensive research about this that does support the use of research in terms of how it improves organisational and service user outcomes. So I'll just outline a few of those now. So obviously these are development opportunities for staff, and I'm sure lots of organisations would want to provide access to development opportunities for staff, particularly around research. And really it's about helping interns develop research skills and build that learning culture within your organizations. Now, the research on research in organizations does suggest that actually service user satisfaction and safety, patient safety, are improved through active organizations involved in research. And in fact, there's a dose effect. So it shows that the more that research is done in an organization, the better the outcomes. One of the mechanisms for improving those outcomes is connections and learning across networks. So one of the things that we will be doing is connecting interns into networks and across networks, and bringing those networks into your organizations through the internships as well. And there is grant funding to employing organizations. It's a little bit abstract, but there is some evidence around long-term savings. So perhaps not short-term savings, you would get some income from this grant for the internship program, but there is also evidence that organizations engaging in research do have some long-term savings. Okay, so in terms of the organizational support for internships, we think that entry and exit points, so entry in terms of developing an application and becoming an intern, and also when people conclude their internship, these are points which organizations can be aware of and really support internships. So the first one is staff release and backfill arrangements. Now, we know that in conversation with our partners that there are pressures in organizations around service delivery. So releasing staff to undertake internships can have its challenges, and we're really aware of that. And also there will be money and funds available for backfill, but we also know that it's not always easy to make those backfill arrangements when staff are released as well. So one of the things that we had feedback on was giving plenty of time for the applications to be developed. So we've allowed 3 months for that in response to employers, so that there's plenty of time to plan and arrange these kind of support for staff to do their internships. One of the other things that we know is really helpful to interns and people developing applications is that particularly for junior staff, they might not be familiar with how to cost their application and particularly around salaries and budgets. So having someone in the organization that they could be signposted to who's either in finance or accountancy or line managers that can direct them to people if they need to cost out their salary for the duration of the ward, organizations can really help support prospective interns with those kind of setup and arrangements to do that. The other thing is mentor and supervision, which I'll talk in detail about in a bit, but if organizations have existing partnerships or collaborations, then directing potential interns to those could be really helpful for mentorship and supervision. We are going to be requiring a manager's letter of support, so the line manager will need to support the intern and send in a letter, and I'll give you details about how that works. But we would really suggest early conversations, and if there's senior level management that can enable managers to make decisions about supporting interns, then we would really encourage that across your organization as well. Then the next thing would be protected time for the duration of the internship. So these again are things that organizations can help with in planning and preparation, so that when the interns do come onto the program, they are able to take up that opportunity. And we again appreciate there's lots of pressures in organizations around service delivery. And then the final bit is that exit point. So when people exit these opportunities, these development opportunities within an internship, thinking about how can organizations value the learning, the development, the knowledge, the networks that they've gained through the internship, and thinking about how the organization can benefit from those. What we know is that the motivation for people taking up these opportunities is often because they really want to make a difference within the services that they work in and for the people they work for and with. And so enabling that learning to come back into the organization can be really beneficial to both the intern and the employer. Okay, so I'll get into some detail now about the internship. The overview is that the aim of the internship is to support qualified and registered health and care professionals to develop their understanding and skills in research that can be applied in ways that improve the lives of the people across our region. The internship will offer HCPs an opportunity to develop a tailored learning and development program with the support of a mentor and supervisor. Now, we're asking that the activities are completed within 9 months, and they will get £10,000 funding towards that. We will be offering 23 internship opportunities in 2026, and then the program is going to run for 3 years. So there will be future opportunities for people to apply for these internships. It's designed to support a wide range of research-related activities, and I'll go through the scope of those activities that we'd like to fund. And we have got a guidance document, and we will be sharing documents and links in the chat as we go along. So eligibility, this is the thing that we get questioned about the most. So people have got to be a registered health and care professional. This isn't including doctors and dentists in this scheme, but people should be pre-doctoral, so they haven't started a level 8 program, but they currently work in the NHS, local government, or an organisation in receipt of funding from the Department of Health and Social Care to provide services. They're employed in an organisation located within the boundaries of the North East and North Cumbria Integrated Care Board, and I'll show you a map in a minute of that geography. They've got to be employed beyond and equal to the duration of the internship, and they have to have an ORCID ID. So those of you who aren't familiar with ORCID IDs, this is a website and a form that you complete. It's a requirement for the National Institute for Health and Care Research that people complete these and have them on their application form. And these ORCID IDs will be looked at by the funding panel as well, and sort of monitor, where you're at with your research journey so far. And so it's important that it's not set as private, so that the panel members can look at that. And there is some guidance on the website, and we will also link to that in our guidance document as well. These are the professions that are eligible to apply. So you can see the whole list there of health and social care professionals, and it's also a requirement that they are registered with one of the bodies that's listed on this slide as well. If you happen to be registered with a body that isn't listed, you can contact us on the email that we will be sharing in the slides, and we can clarify that with you. But it's really important that people are qualified and registered, and so that might exclude some staff who may be working towards registration. There are some professions where they are qualified and then work towards registration. This scheme, unfortunately, is not eligible to you or your employees. If that is the case, they need to have an active and open registration with one of the with one of the bodies listed there. Okay, and this is the geography for northeastern Cumbria that we are applicants can be eligible from. So employing organisations within this geography, within this footprint, are very welcome, and we do want to encourage the widest possible spread of applicants from across our region, and so we have been working with organisations to really support this, and if you can encourage people across the region from different organisations, we really do want to reach as far across as we can. If you are in this call and you're outside of our region, there are other schemes available. So there is a central link on the NIHR website which directs you to the program leads for all of the regional internship programs. So there are some similarities across the programs, but there will be regional differences in terms of timescales and application processes and when competitions open and close. Those are all arranged regionally, but there will be some things that are similar, like the amount of funding that is available to you. Okay, so let's talk about the funding then. So it's an award for £10,000. We're not able to accept any applications that go beyond that. It is for £10,000, including all of the activity. There is a provision for salary backfill for up to 30 days. This can be designed flexibly around the intern and the organisation. We ask that internships are completed within a 9-month period, but I'll give you some more detail on that as well. It's really important that we have backfills to release staff to do these opportunities. But if you're in an organization where this is part of somebody's development plan to have some research time, it doesn't have to be used on salary backfill. So it could be used for other activities for the internship if the organization doesn't require salary backfill for the intern. And so the funding is there for salary, training, projects and associated costs. And in our guidance document, we have a detailed breakdown for suggestions of what is included and what is not included in that. The budget breakdown and spend should align with the employing organisational policy. So when applicants are costing the policy, the application form, they should be referring to your employing organisation expenses policy. So for example, if there's travel involved and they need to travel by car, then the claim for that travel would be based upon your organisational expenses cap on what they can claim for. And if there are overnight stays or visits, then similarly, we'd expect them to comply with your organisational policy for what they can claim for those kind of costs. So the £10,000 is paid directly to the employing organisation for successful interns. What that means then is the organisation in receipt of that is responsible for how that money is administered, whether it be for salary to a budget specifically on that, or whether it's for training or travel. All of those costs and are administered by the organisation in receipt of that £10,000 that employs the intern. And internships can start after hearing about their success in receiving the award from March. There's some flexibility on that, so they can start later than that, but we're asking that they would start no later than June, so they have at least 6 months as an intern. There's additional financial guidance from the NIHR as well, which we link to in our guidance document. Okay, so let me just talk about the pathways that people can take on for internships. This has really been set up by the NIHR, and these are pathways that we will be asking interns to indicate which one they're closest to. So stepping into research, growing in research, clinical practitioner, academic leadership, and delivery of research as well. So just to define those for you, stepping into research is a clinician or a practitioner with little or no research experience who want to take a first step into research to learn about ways to engage with research, improve professional practice, and embed research in practice. So this is really important, and we really want to encourage those people that may be put off by thinking that actually I haven't had any involvement with research, I don't really know anything about it. Well, actually, this is a scheme for those people, those professionals. This is an opportunity for them to develop a learning program for themselves and link with people and start to discover things about research that are really relevant to their work and are that kind of first step into understanding how research works and can work in organizations. Then if you have people in your organizations who are involved in research delivery in any capacity and want to really learn more about how to deliver research, what's involved in that. They want to extend their research delivery skills, improve research delivery practice and leadership, and gain experience, then this is also for them. So it may be that they're not leading research, but they're really involved in delivering research in any kind of way, then we want to extend their skills. And we do have really good links with the research delivery network in the region. And so even if there are opportunities to link with them and to learn more about that, we would encourage people to have those links as well. And then growing in research, this might be for enhanced or advanced practitioners, more senior who are a little bit further along in their career. They want to develop research pillar of their role and develop team research culture and confidence. And then finally, people who might see themselves on that kind of track that we showed from internships through to pre-application, pre-doctoral, and want to develop a clinical academic or practitioner academic career. This could really lay the foundations for that and help them develop in that direction towards becoming a future research leader or building towards a future funding award application. Line manager support is really important. We know this from the organisations that we work in and work with. And what we're really looking for is line managers to send a letter of support, which must be signed and dated and have their employing organisational logo on it. The letter should include a statement about the support for the application and confirmation that they'll be released from day-to-day duties to complete the proposed internship. So we'd encourage early conversations within your organisations, within your line managers, with your line managers about preparing this and getting authorization if it's required in your organisation to send these letters. Supervisors and mentors, I'll spend a bit of time on this because it's really important and it's central to the success of the programme. Mentors are formally responsible for overseeing the interns' work and ensuring they meet the objectives. They're voluntary, so there is no funding for for mentors and supervisors within the programme. But interns need to identify their own supervisor and mentor, and we have a list. We have a list of internship champions, which I will go on to talk about, who can help signpost and help people navigate some of this process. They should be one person. So although interns might include in their development plan or their activities meetings with a team or multiple individuals, the supervisor or mentor is one person who's designated on the application form as supporting the intern. And they can have responsibilities around setting goals and realistic deadlines, being a role model, developing the internship project, and just offering that support for the intern throughout their development within the funded work that they're doing. We've also set up some calling cards. So this is for you if you want to be a mentor or supervisor. It could be that you lead a research group or you lead a project or program, and you think, well, actually, in our organization, we could accommodate an intern to work on something that we're already involved in. And so these calling cards are being used on LinkedIn, and we can share them with you. So if your group or you yourself or your project, your organization would like to host an intern, then you can advertise that opportunity as well, and that might mean that you can then develop an application with an intern right from an early stage and have a really strong proposal. Okay, I mentioned internship champions. We're really grateful to a wide range of volunteers who have come forward to say that they're going to help internships and interns across the region to navigate this opportunity. And they can be from organisations across professional networks or have had some prior experience in this area. And there's a form to complete which has just been put in the chat. So interns can look at the internship champion form. There's a list of them. They've all given us their permission for their emails and contact details to be shared, and you can see which organisations and professional backgrounds they're from, and they can be contacted directly. If you would like to volunteer as an internship champion in your organisation, so if there are people that you think you can help navigate this opportunity from your employing organisation, or you have a role in supporting research capacity building or any kind of support that you would like to offer, do complete that form and we will include you and your contact details. Okay, so this is our timeline. So application forms are open. So we've got all the links, and you can see the application form now and all the guidance and FAQs and the documents that you need. This is our webinar today for organisations to give you sort of prior notice to help you with potential interns in your organizations to take up this opportunity. And then we have an application, an applicant webinar on the 24th of November. We've got quite a lot of signups for that, just under 100 signups already for that webinar, but do encourage others to come along. We will be presenting some very similar information than I've shared with you today, but we also have speakers who have been interns. We have 3 speakers, and they're going to be sharing their experience about the learning and development they had within their internships as well, and some of their professional development. Then the applications close on the 6th of February, and then we will let interns know if they've been successful in March. We will be offering some feedback. It will be relatively brief, but we will be offering feedback to applicants who are unsuccessful, and they would be eligible to apply for a future round as well. Okay, and I just wanted to give you sight of the application form and some of the guidance documents and links. So it's a relatively simple application form. It's in a Word document that will be emailed back to us. So there's no website to go through or online forms. It's a very standard document. And what you can see is we want people to talk about their experience. If they don't have a great deal of research experience, that doesn't exclude them from applying. We'd just like to hear about their interest and what they'd like to achieve. If they provide details around what they're going to do in their internship, what personal development that would involve, their future career intentions, and how will it benefit the organisation they're in and their work. And then the final section is the budget breakdown, so that we can just look at what activities are going to be funding, including salary costs, if that's required as well. And then in terms of the things that we will support and offer to interns on the programme, so once they're with us, we would be looking for them to attend a face-to-face event. We're calling it a belonging event in April. And so do consider that and ask your interns to consider that. That will be a face-to-face meeting in the region. And so having some capacity for travel, if that's required, then do just consider that in your budgets as well. We will also have a face-to-face celebration event in December, and that's really just to look at the learning that the interns have had and what they've achieved during their internship, and that will be also for mentors and line managers to come as well to that event. And we will give dates well in advance so that that's in people's diaries, and we'll let people know the kind of venue and area that they need to travel to. Okay, so that's all of the information from me. Do continue to put any questions in the chat and we will go through them afterwards. But I'd very much like to welcome Professor Hamdi Nazar, who's going to talk about her experience of being a mentor for interns.
Hello, can you hear me?
Yeah, do go ahead.
Perfect. Okay. Hi, everyone. So I'm a pharmacist by background. I am a professor of pharmacy education and primary care research in Newcastle University. I'm also part of the NIHR funded patient safety research collaboration. So I do research specifically looking at patient safety, and I'm a theme lead looking specifically in the area of safer integrated care models. Very wordy. So I was just thinking about, I've mentored many individuals, and I was just thinking about the person who most likely fits this call and the type of people who potentially could be applying, and sharing some of the experiences that I've had with them through this journey. So the I think firstly having this webinar and inviting organisations who, it's really key that you understand like the value of the internship, so that potential applicants can come to yourselves and ask for support and have those conversations around budgeting and time and backfill, because I think each individual, it's going to be a different ask, and I'm very aware that the individual who was interested to intern with me sat down with their line manager, and it was a very bespoke conversation about how they would use that money in terms of whether it's going to be backfill, whether it's going to be training, or whatever else. And myself as a mentor, I wasn't involved, as was mentioned. As a mentor, I wasn't paid or didn't get any incentivization as such to be involved in the process. So the individual had that conversation with their line manager. I knew the individual because we had come across each other in networking meetings. So they work in a pharmacy department, and the School of Pharmacy at Newcastle had engaged with a lot of the pharmacy departments in the trusts around the area to talk about research capacity and capacity building and research and things like that, and trying to identify how we could work together. And that individual had been in the meeting and had heard me talk about my research and had gone to look me up, and identified me as someone that they might like to work with. So sat down, had a conversation, and it was interesting that on that slide there, one of the slides that Simon had was about the entry and exit point. And that conversation, that first conversation with that potential candidate, was, what is the exit point? What do they want from this? So we know what we're working towards. And therefore, that 9-month experience could be designed in such a way to support that individual to achieve those goals. And I think I'm still meeting with that individual, despite the fact that the internship is over. I think it finished in March, but I'm not counting the days. We are meeting on a weekly basis. We have a Tuesday meeting, an hour meeting, and we always look at the objectives. We always look at what we said at the beginning. What did that individual want to achieve? And we almost look at that, if not every week, then every other week, to see how we're getting on with progressing with that, what the output's looking like, and identifying any further needs that that individual might need. So it has been a very organic relationship in terms of how we achieve those goals, and there was some shift. So as we started to get underway with the work, the individual got underway with work and I was supervising, mentor them, things changed along the way, in terms of the individual wanted to eventually apply for a PhD. So through the whole of the 12 months or so that we've been engaging, we've been trying to explore different ways of getting funding to support this PhD, but also allowing that individual to stay clinically active, because that was really key for them and also really key for their organisation. So in the last month or so, we've been able to identify a potential funding scheme that will be able to support that individual. And now they're having further conversations with their organisation about how they might be able to support that PhD, I think 1 day a week in the future. So, I mean, there were a few things that I was going to talk about, which Simon's kind of highlighted in his slides about the value of this. So I think, yes, I would concur with all of the things that Simon said about the value of an intern within an organisation, the value to the organisation and the value to the service delivery and to patients. There's, I think, other things that potentially haven't been mentioned. So I'm on a credentialing committee for the Royal Pharmaceutical Society. So I look at portfolios, professional portfolios, to assess whether pharmacists can apply and get recognition as a consultant pharmacy. And there's particular pillars that pharmacists need to evidence to gain that recognition. And I specifically look at the education and research pillars. And what we see within the pharmacy profession is it's actually quite tricky for pharmacists, clinically active pharmacists, to gain that experience in terms of building skills, getting involved in projects, dissemination, and all of those other things. So I do think internships give individuals that time, dedicated time to develop themselves in those key areas, which obviously allows them career progression, but it also makes that organisation more attractive for future recruitment and for retention of staff. And I think that's really, really key. The other thing, which I think is potentially another additional value, is once that individual is upskilled, they can then go on to bring research culture into that organisation, whether that means with the current staff or to engage with external networks, to work with other people, external people, to supervise interns themselves, to supervise other individuals to support research. And therefore you start to see a seedling grow into a tree, and it just starts to fortify and build the capacity, research capacity. So I think there's really, lots of value around doing these things. So the individual that I'm working with at the moment, what we have achieved, so they have used the 10,000 around about that money for backfill and for training purposes, and they had to stipulate that on the form. However, because I belong to the PSRC, the Patient Safety Research Collaboration, we do have the capacity to support people in research development. So we have funds to support that, and we have funds within my theme. So that individual has benefited from further research training that was funded through the PSRC that didn't have to come out that 10K. So I know they've gone on additional training that wasn't in that initial application, and they've also been able to attend conferences that were covered through funds from the PSRC, because we were investing in that individual and in that work that they've done. So I think the 10K is, yes, it is a baseline, and you do have to consider where that's going to be spent. But I think with the mentors that can be identified and the connections they have and the other things, the other activities that they're getting involved in, there will be potential enrichment of that experience. But you're only going to know that until you really, get underway with the internship. And the other thing to mention is that exit point again. So that individual was looking about, okay, what's next? Okay, that's 9 months down the line, but whatever we do now needs to align to what it is I need to apply for next. So along the way, we've been looking at different funding calls, different pots of money that could also go on to subsidise or support that individual, either within that 9 months or beyond. So they do get a lot of support in terms of doing the work that they've identified for that 9 months, but also future planning to see what they're going to do or want to do next. I think that was really what I wanted to cover. And I was just looking at some of the few questions that came through just to see if I could cover those. So I think I've covered it. The one about backfill and the 30 days spent on these activities. The 30 days, that's flexible as to what the individual spends those on. So yes, in the application, you do have to articulate what the envisaged objectives are and development trajectory. However, as I said, it is an organic experience. Things have happened along the way, either in service delivery or in network meetings and things like that. And we've taken up opportunities that weren't written in the original internship application. So I think, yes, stipulate something specific within the application, but I think the mentor and the existing infrastructure they live within can offer other experiences and opportunities for the interns. So hopefully that was helpful, Simon. So I'm happy to pass back or take questions.
Thank you, Hamdi. No, that was really helpful and really nice to hear about how that mentorship relationship has developed as well. So yeah, thank you very much. Really, really helpful. So we're now able to take some questions from you. If you want to put more questions in the chat, then do go ahead, and Holly's going to field the questions and read them out, and then we're going to, between us, try and answer as many as we can or direct you to where that information is. So have we got any questions currently, Holly?
Yes, so would staff working in hospices be eligible as their funding is often from charity?
Yeah, so that's a really good question. The stipulation is that services or employers are funded in part by the Department of Health and Social Care. So if organisations receive some money from the Department of Health and Social Care to provide some of their services, then that would make them eligible. But if it is completely charitably funded or charitable funding, then unfortunately this scheme they would not be eligible for this scheme.
Another question, is the region linked to staff members' base or to the organisation? For example, Tees, Esk, Wear Valley have bases across the North East and North Yorkshire.
Yeah, so I think we're going to go with employing organisations within the region. That would be the basis for it.
Is the backfill included in the 10K? And I've just responded that in the chat. Yes, that is included in the 10K. 10K is the maximum cap for this internship opportunity, and that covers all of the interns' activities and backfill. And if you do request less than 10K in your application, you can't come back and ask for additional funds, as it will be based on what was placed in your application.
Thank you, Holly.
And then someone had said, so up to 30 days spent on these activities.
Yeah, that's right. So, well, there's 30 days which we're able to do salary backfill for. As I mentioned, if organisations are able to release staff without the need for salary backfill, then the funds can be used for other purposes, training or whatever is required within the internship. So that proposal can be put forward. So I hope that clarifies it. Yes, but there's 30 days salary backfill funding up to that, and that can be from blocks or day release or whatever really works for that individual and the service that they're working from.
And there isn't any more questions in the chat at the moment.
Okay. I'll just give a moment if there's any more questions people want to type in the chat, and we'll respond to those. Otherwise, we've linked to the guidance document and other forms that you can have a look at in the chat as well. So hopefully you've got the information and the links you need. I'll just share my slide briefly as well, just so that you've got the email address. So if there are any queries, you can contact NHRP Academy at newcastle.ac.uk. So do that. We've got another question, I think, coming.
There's one question. If I'm not able to meet up with this current cohort, when will the next come up, please?
Yeah, so we are going to run this for 3 years. We've got funding for 23 interns a year for the next 3 years. That will come out at a similar time to this next year. So in 2026, we will be having similar promotion around the application opening and the timescales. So all of the information that you have seen circulating now to you as an individual and across your organizations, we will be promoting it next year so that there will be notice of the next round in 2026. You're welcome. That's great. Okay, I'll just give one more final request for questions, and then if we don't have anything else from you, we can close the meeting a little bit early. I'll just mention that do pass on the details about the applicants webinar, which is on the 24th of November. And as I say, we will be including speakers who have had internships, and they can talk about their experiences, just as you've learned about the mentor experience from Hamdi today. So thanks. Holly's just shared that link. Okay, well, I'm not seeing any more questions come in, so I hope that's answered everything. You've got the links to all the information, the guidance documents, the FAQs, the application form. If there's anything that isn't answered in those documents or is unclear, it is we are updating the FAQs in response to any queries that come in. If we answer them directly, but if we think it's going to be of general benefit for people to know information you're seeking, we will put that on our FAQs. And so we do find your questions really helpful, because it does help us to make sure that we're giving everybody a fully informed information, so that they can take up this opportunity. Okay, well, we're 15 minutes early, but thank you very much for attending today. I hope you found that helpful. I'd like to thank Holly and Claire behind the scenes, and also Hamdi for contributing to today. And we look forward to receiving applications from your organisations and internships, intern prospective